Good morning.
Good morning, ma'am.
Happy New Year to all.
Happy New Year to you too, ma'am.
स्क्रीन दिख रही है?
Yes, ma'am.
Okay, good. Okay, shall we start the session? I am audible, right?
Yes, ma'am.
Yes, ma'am.
Okay. So, किडनी डिसऑर्डर का आज हम लोग देखने वाले हैं अबाउट द इन्वेस्टिगेशन एंड द मैनेजमेंट पार्ट. ओके. So investigation में basically we go for the if we are thinking about the kidney disorder. So कोई भी kidney disorder से related अगर patient आता है हमारे पास, so first of all we think about the blood investigations and the urine examination, correct? So in urine examination is very important in cases of the kidney disorder. So urine examination में what we check? क्या क्या चेक करते हैं?
Routine urine.
रूटीन यूरिन. सो रूटीन यूरिन एग्जामिनेशन में हम लोग क्या क्या चेक करते हैं? जनरल. जनरल जब भी पेशेंट को हम
Creatine level.
सॉरी
Creatine level.
क्रिएटिन लेवल, करेक्ट. और
uh, Uric acid.
यूरिक.
यूरिन में पसल्स है कि नहीं।
यस, पस सेल्स है कि नहीं, क्रिएटिनिन चेक करते हैं. और
Higher amount of glucose and proteins.
यस, ग्लूकोज एंड प्रोटीन्स, दीज आर द वेरी इंपॉर्टेंट. और हम लोग क्या क्या चेक करते हैं? बस चार ही चीज़ें चेक करते हैं हम लोग. यूटीआई के तो बहुत सारे.
ब्लड,
या
मैम ब्लड ब्लड अगर रहेगा यूरिन में तो
yes, blood. So RBC रहता है, so RBC we check. So generally when we talked about the urine analysis, so we checked about the physical examination, biochemical examination and the microscopy. So physical examination में what we check? What we are checking about the volume, color, turbidity, odor, pH and the specific gravity, right? Whereas in biochemic examination we checked about the protein, sugar, ketone bodies, bile salt, bile pigment, blood. And in microscopy we check about the cells, crystal, cast, microorganism and the parasite. So sometimes less culture is also help. Urine culture is also help in identifying the microorganism and parasite. But even urine analysis में हम लोग ये सब चीज़ें देखते हैं. ओके. सो हम लोग इसका डिटेल में देखेंगे आगे. सो सबसे पहले टेस्ट फॉर द स्क्रीनिंग एंड डायग्नोसिस. ओके. सो आप लोगों को पता होगा कि नेशनल किडनी फाउंडेशन एंड द नेशनल किडनी डिसीज एजुकेशन प्रोग्राम, ओके, they recommended that people at a high risk to be screened for kidney disease. So high risk meaning those patient having a hypertension, those patient having a diabetes, even neonatal diabetes. So they, according to they should be screened every year or every 6 months. Okay. So the NKFF recommend that everyone with diabetes between the age of 12 to 17 to be screened at least once a year. Okay, at least once a year or twice a year. But children with a type 1 diabetes should be screened for kidney disease within a 5 year of diagnosis while children with type 2 diabetes should be screened as soon as they are diagnosed. So both should be screened for kidney disease once a year. So if we know that the patient having a diabetes or patient having a hypertension or children the neonatal diabetes, so we know these patients are at a high risk to having any type of the kidney disorder. So you should advise them to check the KFT regularly. Okay, so kidney function test. So kidney function test or the urine test, they should check regularly. Okay, so even NKF recommended generally the two taste. Okay, so they recommended two taste to in addition to the blood pressure measure and the, even the diabetes measurement, urine protein and the GFR. Okay, so in urine protein, maybe what we are different taste can be used to screen the protein in the urine. Okay, if there is a protein in the urine, there is high risk of any type of the acute kidney injury also or the chronic renal failure also. So यूरिन प्रोटीन में हम लोग जब यूरिन एनालिसिस करते हैं ओके so what we checked in urine protein so urine albumin and the albumin creatinine ratio okay these detect the small amount of albumin in the urine and second is the urine analysis. This is the routine test which can detect the protein in the urine as well as the red blood cell and the white blood cell. Okay. यूरिन एनालिसिस में जब भी यूरिन प्रोटीन नॉर्मली हमारी यूरिन में नहीं दिखते हैं ओके सो दैट कैन इंडिकेट द किडनी डिसीज another is the urine total protein and the urine protein to the creatinine ratio okay what they detect the small amount of albumin also okay so they detect every type of the protein whichever present in the urine so these are the first tests we can do for the urine protein analysis if we are a confusion that protein is present in the urine or not. Another is the estimated glomerular filtration rate. So it calculates based on the result of the blood creatinine test and the crystalline C test. Okay. It also depend on the age, sex, and the sex. So that glomerular filtration rate refer to the amount of blood that is filtered by the glomeruli per minute. So as the kidney decline, so kidney का अगर function decline हो रहा है, so filtration rate automatically decrease हो जाता है. Okay, so it directly proportional. So glomerular filtration rate is directly proportional to the filtered by the glomeruli per minute. Okay. So how we measure the GFR? So generally GFR measure करने के लिए दो मेथड होते हैं. Okay, direct assessment and the indirect assessment. So direct assessment there are some clearance tests and indirect assessments from the serum creatinine. Okay. So what is direct assessment? Clearance test मतलब हम लोग क्या करते हैं? So generally when we measure the GFR, okay, so volume of the fluid filtered into the Bowman's capsule per unit time. So these is the equation we used to measure the GFR. So GFR is glomerular filtration rate. UX it's a concentration of X in the urine. This is the V is the volume of the urine formed in given time, and P is the concentration of X in the systemic blood plasma. Okay, this is the formula of GFR. Okay. In the practical examination also, the examiner may ask you, tell me the how you measure the GFR or the GFR formula. So you should remember that UX into the V upon PX. Okay. So this is the method when we use the GFR. This is the formula. So as I said, there are two methods, okay? Direct assessment and the indirect assessment from the serum creatinine. So direct assessment, when we talked about the clearance test, so clearance test में what we see, volume of plasma that is completely cleared of the substance per minute, okay? So clearance is equal to UV upon P. So concentration in the substance urine, volume of urine per minute and concentration of the substance in the plasma. Same formula. Okay, so this is the same formula we measure for the GFR, but to assess there are the different method to measure the GFR. So clearance test, there are one is the insulin clearance test. Okay, this is the gold standard for measurement of the GFR. Okay, so there are we take a different time urine and the blood samples and we measure the GFR. Okay, so disadvantages of that insulin clearance test, it's very time consuming and the expensive because we have to measure the timely. So for example, we asked the patient to give the urine samples of morning also, afternoon also, evening also, and night also, and even the midnight also. And then we measure the insulin clearance test. So it's very time consuming, it's expensive. Okay, it's need to maintain the steady plasma level. Generally, the normal volume is males is 125 ml per minute per 1.73 and female is 110. ये समझ में आ रहा है ना कि कंफ्यूजन हो रहा है?
समझ रहे हैं।
दिस इज द इंसुलिन क्लियरेंस टेस्ट. ओके, अनदर इज द डायरेक्ट असेसमेंट जब हम लोग करते हैं टू. ओके, सो क्लियरेंस टेस्ट में इंसुलिन क्लियरेंस टेस्ट करते हैं एंड क्रिएटिनिन क्लियरेंस टेस्ट में दिस इज द मोस्ट कॉमनली यूज्ड. ओके, so it's secreted in the small amount overestimate of the GFR. So it produced from the creatine in muscle. So what they do in this method, 24 hours urine samples can be collected. Okay, and a blood samples is obtained at the midpoint of the urine collection. If we are using the blood samples, so blood samples से जब हम लोग ये method करते हैं, so it's midpoint of the urine collection. Whereas urine sample, if we ask for, so 24 hours urine sample हम लोग we ask for the patient and we calculate by the formula C is equal to UV upon P. Okay, and this estimate, this is the easy method because it's time consume time less लगता है इसके लिए, it's inexpensive. So this is the method generally we go for. Now also when we go for the GFR estimation, so we go for the creatinine clearance test, not for the insulin test. Okay, so by estimating the GFR, what we are going to find out, so if there is, after using that formula, after estimating the urine sample, if the state is 90 plus, so we describe as a normal kidney function. And the treatment part is we only go for the observation. If the patient is diabetic or patient is the hypertensive, we ask patient to monitor the blood sample or the blood examination or the blood pressure, monitor the blood pressure and the sugar level. Whereas if there is a GFR is 89 to 60%, we describe as a mildly reduced kidney function and we ask the patient to ask for the observation, control of blood pressure and the risk factor. So GFR, why the GFR is so important, because by this we able to understand the how much the kidney is functioning, how much properly the kidney is functioning, and we go for the treatment part. So treatment part is also according to the function of the kidney. सो अनादर इज द स्टेट इज द 3A and 3B. ये हम लोगों ने स्टेट देखे थे, राइट? सो 59 to 65, 59 to 45% or 44 to 30, it's moderately reduced kidney function. We go for the observation, even the control the blood pressure and the risk factor. And fourth is the 29 to 50%, means severely reduced kidney functions. We planning for the end stage of the renal failure. And less than 50, this is the kidney failure. So we go for the another treatment. So dialysis or hemodialysis, there are different methods. We will see about the different method of kidney failure also. यहाँ तक किसको को कुछ कंफ्यूजन है?
No, no.
Okay.
No, ma'am.
Okay. So this is how we estimate the GFR. Okay. So another is the general test. Okay, so general test for the kidney function and the disease. Renal panel. So renal panel matlab this is the group of the renal test or a group of the kidney test which can use to evaluate the kidney function or screen or diagnosis monitoring the kidney disease. Okay. सो सबसे पहले इलेक्ट्रोलाइट आते हैं उसमें. सो इलेक्ट्रोलाइट में हम लोग क्या क्या चेक करते हैं? सोडियम, पोटेशियम, क्लोराइड एंड द बाइकार्बोनेट. Another is the creatinine. Then the urea. So urea may be we also check for the urine nitrogen or the blood urea nitrogen. But another is the phosphorus, calcium, albumin. Glucose level. Even in the we check for the glucose level. So glucose level we can check by the blood test also, by the urine examination also. Okay. देन क्रिएटिनिन क्लियरेंस. सो क्रिएटिनिन क्लियरेंस जो हम लोगों ने देखा था ईजीएफआर चेक करने के लिए. सो इट मेजर्स द क्रिएटिनिन लेवल इन बोथ द सैंपल ऑफ द ब्लड एंड द सैंपल ऑफ द यूरिन from a 24 hours of the urine collection. Okay. Obviously, the decreased creatinine clearance, it indicates the decreased kidney function test. Then the PTH. PTH is the parathyroid hormone. Okay. Parathyroid hormone, what they do? They control the calcium level in the blood. Okay. But in cases of the kidney diseases, they increase. We check for the hemoglobin. So hemoglobin, even when we checked about the blood examination, so blood examination, we check for the hemoglobin because in kidney diseases, it's very common anemia condition. So anemia condition for the patient having the anemia with the kidney disease or not, we check for the hemoglobin. So the kidney makes the hormones which called as the erythropoietin, which control the red blood cell production, and this may be affected by the kidney damage. Okay. So erythropoietin also we can check directly by the blood examination or we go for the hemoglobin test. Another is the beta 2 microglobulin. Okay, what they do taste, it generally evaluate the kidney damage. Okay, and even the it distinguish the disease between the glomeruli and the renal tubules. Okay, so beta 2 microglobulin we go for the urine examination. Okay, we ask the patient of 24-hour urine examination and then we check for the beta 2 microglobulin. Uric acid. So uric acid, what they do? They estimate from the body by the kidney and frequently elevated in the chronic kidney diseases. So uric acid also we checked. We also check the vitamin D because in some of the kidney disorder, so vitamin D level often decrease. Okay, so that's why we check the vitamin D. These are the general tests we do for the kidney function test and the disease. Another other test is the urine analysis with a urine culture. Okay. Then the blood culture. So blood culture possibly done to help to detect the sepsis. Then the hepatitis B and the hepatitis C testing, which can detect the hepatitis viral infection because some of the kidney diseases, one of the major causes the hepatitis B or the hepatitis C. So it's very important to go for the hepatitis B and the hepatitis C testing if you are finding that type of the symptoms. Then the anti-nuclear antibody and the anti-DNAs, it can help to identify the autoimmune condition, for example, lupus. So you all know that lupus is also affected the kidney. So for that condition, you need to check for the anti-nuclear antibody and the anti-DNA. Then the kidney stone risk panel. So kidney stone risk panel means these evaluate a person risk of developing the kidney stone. So it helps to monitor the treatment and the prevention. So generally all these tests we go for to help for the diagnosis also, for the treatment part also, and from the preventive part also. So how we do the kidney stone analysis? So generally, these tests is determine the composition of the kidney stone, passed or the removed from the urine tract, and it may be done to help the determine the cause of its formation to guide the treatment and prevent recurrence. So if we are doubting of a kidney stone, we also go for the ultrasonography, right, or the imaging. But the other analysis also we go for the kidney stone analysis. So what we do, 24 hours urine analysis हम लोग करते हैं, and that test measures how much urine a child can produce in a day. So acidic pH of the urine and the amount of the certain substance he needs. Okay, so amount कौन से substance present है या फिर kidney stone present है या नहीं है, that we do for the kidney stone analysis. But this is very old method. Okay, Right now we don't go for the kidney stone analysis to detect or to for the diagnosis purpose of the kidney stone. We generally go for the sonography or the CT scan. So imaging methods are generally used for the kidney stone, because this method is it's very time consuming also, it's expensive also, and it take time also to detect or to diagnosis. Whereas in ultrasonography or the imaging method, within a 5 or 10 minutes you're able to understand whether patient having a kidney stone or not. Another disadvantages of these kidney stone analysis is how long kidney stone is, और how कितना मेजरमेंट जो होता है किडनी स्टोन का, वो ये मेथड से हम लोगों को नहीं समझ में आता. वेयर एज इन सोनोग्राफी और इन इमेजिंग वी एबल टू अंडरस्टैंड द मेजरमेंट ऑफ द kidney stone. So nowadays we don't go for the kidney stone analysis. We generally ask patient to do the sonography or the imaging method. Another is the urine protein electrophoresis. It can done to help to determine the source of a high level of the protein in the urine. Myoglobin. So myoglobin also we need to check, because uh, generally if there is a severe muscle injury, okay, there is presence of myoglobin. So even in acute kidney failure or the acute kidney injury, we able to see the myoglobin in the blood. Imaging technique. So imaging technique suspected the structural problem, blockage. So there are different type of the image technique: ultrasonography, CT scan, isotopic scan, or the IVP. So IVP is the intravenous pyelogram. So in imaging technique, generally we done for the ultrasonography, CT scan, or the IVP. Another is the kidney biopsy. So why we do the biopsy? So it biopsy is generally help to determine the nature and the extent of the structural damage to the kidney. So what they do in the biopsy, they analyze a small piece of the kidney tissue, okay, which can obtain using a biopsy needle, and the diagnostic imaging equipment can be sometimes be useful when the disease of the glomeruli is suspected. Okay, so either they go for the needle biopsy or they go for the open biopsy. So the piece of the kidney, so the piece of the kidney they do, so the piece of the, Priyanka will give you answer, okay? Just a second. So, what they do the biopsy? So, generally, piece of the needle biopsy, they by the needle biopsy or by the open biopsy, piece of the kidney structure they measure, okay, and they see ki whether this is having a carcinosis or not, or the any chronic kidney failure. So, they able to understand this. So, what are the different indication to do the kidney biopsy? If patient having a nephrotic syndrome, acute renal failure, systemic disease, subnephrotic proteinuria, or the hematuria, or the post transplant. Contraindication: if patient having a solitary kidney, multiple cyst, acute infection, renal neoplasm, bleeding diathesis, or the severe hypertension. So patient having generally tendency for the bleeding, or there are presence of multiple cyst or the acute infection, we not ask patient for the biopsy. Why? Because there are certain complications of the kidney biopsy also, because we use the needle or the open biopsy, right? So contraindicate what happened in the complication, patient may go for the hemorrhage, AV fistula, infection, there is accidental biopsy, or patient might death. So death is the last complication. So generally, if patient having these type of illness, or there is multiple cyst or the bleeding diathesis, we don't go for the kidney biopsy. Okay, Priyanka is asking, Priyanka, you want to ask the IVP or IVV?
IVP,
Okay,
polygram, thylogram, sir.
पाइलोग्राम. ओके, पाइलोग्राम में हम लोग क्या करते हैं ना, देर आर सर्टन एजेंट. ओके, सो वी गो फॉर द एक्सरे जनरली. ओके, सो इमेजिंग जो होता है, सो लाइक सीटी स्कैन जैसे हम लोग एग्जामिन करते हैं वैसे ही हम लोग एग्जामिन करते हैं. सो वी जनरली इंजेक्ट दैट सर्टन टाइप ऑफ बायोमार्कर. ओके, सो दैट बायोमार्कर शोज द साइज ऑफ द किडनी. फॉर एग्जाम्पल जैसे हम लोग सोनोग्राफी करते हैं. ओके, सो सोनोग्राफी में हम लोग का कैसे होता है, वो नॉब होता है, राइट. सो नॉब जब हम लोग फिराते हैं, सो वी एबल टू अंडरस्टैंड द किडनी, जो भी किडनी का स्ट्रक्चर है या क्या है. सेम वे इंट्रावेनस पाइलोग्राम में वी इंजेक्ट सर्टन बायोकेमिक और सर्टन केमिकल्स, सो दैट जब कलर रहता है किडनी का, दैट शोज द डिफरेंट. ओके, so it's type of CT scan only, but we inject that type of pyelogram and then we go for the X-ray. हम लोग एक्सरे निकालते हैं वो किडनी का, एंड देन वी एबल टू अंडरस्टैंड कि किडनी प्रॉपरली फंक्शन कर रही है या नहीं कर रही है, या फिर कहीं पे ब्लॉकेज है, या फिर कहीं पे स्ट्रक्चरल चेंजेस हो रहे हैं. दैट वी एबल टू अंडरस्टैंड बाय द IVP. ओके,
Okay, ma'am.
एनी कंफ्यूजन अदर?
No, ma'am.
ओके, सो जनरली अगर पेशेंट को बैक पेन है, या फिर पेशेंट प्रेग्नेंट है, या फिर पेशेंट को अदर सिस्टमिक इलनेस है, ओके, सो अपार्ट फ्रॉम द किडनी, if patient having the infection in the liver or infection in the pancreas, so we don't go for the IVP, because there may chances patient go into the other complications. So recently if we need to check for the imaging technique, we go for the ultrasonography, and the basic is the CT scan. So IVP is also expensive treatment, expensive investigations. Sorry. Okay. So
कोणत्या वेन मधून बायोकेमिकल इन्सर्ट करतात मॅम
intravenous
IVP मध्ये?
IVP generally we insert into back only. Back मधनं आपण जे C3 किंवा C4 मधनं आपण ते insert करतात IVP, because kidney back side ला असते, right? So where
Yes, ma'am.
we insert. Okay.
Yes, ma'am.
Any other confusion?
बॅक साइड ने मग वेन मध्ये असतात की डर्मलीच?
Dermally, but they go into the, for example, CSF fluid हम लोग कैसे चेक करते हैं ना, so we go for the long
हाँ.
needle, right? So we use that
Yes,
long
ma'am.
needle. So even for the intravenous pyelogram, we use the long needle. Okay?
Okay.
Yeah. So even IVP में जब हम लोग needle का use करते हैं, so either from the back side or even from your arm side also they go for the IVP treatment. So like blood examination के लिए हम लोग कैसे check करते हैं, so that also we can go for the IVP. So that contrast material, that biomarker you used. There are different type of the biomarker. हम लोग वो देखेंगे आगे. Okay? प्रियंका?
Okay, ma'am.
क्या? So another is the kidney biopsy जो हम लोगों ने देखा. So this is the test for biomarker of acute kidney injury. So there are severe biomarker. Okay. So studies suggested that blood and the urine test for those biomarker can detect the acute kidney damage earlier than the currently used kidney function test. Okay. So early detection of the acute kidney injury, it's very critical because injury occur rapidly over a period of the hour to the death. So these are the biomarker. Okay. So urine insulin like growth factor binding protein 7 and the urine tissue inhibitor of the metalloproteinase 2. These two markers have been combined into the point of care test. Okay, these two biomarkers. Other biomarker is the neutrophil gelatinase associated lipocalin, so NGAL. This is a protein that is found in many tissue in the body, including the kidney cells. So it's a good indicator for the acute kidney injury because its level rises rapidly in response to the kidney injury. So typically within a 2 to 4 hours, these biomarker has rise and we able to understand the person's having a acute kidney injury. Other biomarker also they are currently studying, but there are the molecular one, KIM1, intraleukin 18, liver type fatty acid binding protein, and the tissue inhibitor of the metalloproteinase 2. Okay, these are the biomarker generally used. So nowadays only two biomarkers we used. This is the urine insulin like growth factor binding protein 7 and the urine tissue inhibitor of the metalloproteinase 2. So these two biomarkers used which can help to identify the kidney function and the kidneys properly function or there is a acute injury or the chronic renal failure. But these biomarker study are very expensive. Okay, so these biomarker study can be done using either a sample of the tumor tissue or the blood sample. So when the blood sample is being used, this procedure is known as the liquid biopsy. Okay, so currently the tissue testing is the most common procedure. So biomarker can be characterized the biological property of the molecular that can be detected and measured in the part of the body like of the blood or the tissue. This may indicate the either the normal or the disease procedure in the body. This is the biopsy study. Okay, so the biomarker and the biopsy. Then the specific gravity. We also check for the specific gravity in the urine examination. So why go for the specific gravity? So the normal value of the specific gravity is the 1.003 to 1.030. Okay, so it depends on the hydration and the fluid intake. Generally, specific gravity increase in cases of the proteinuria, glyceria, glomerulonephritis, and the urinary tract obstruction. Decrease in cases of the diabetes, in where there is an increased water intake, disease of the tubules, and the CFR, chronic renal failure. Okay, so we check for the specific gravity. Then the water deprivation test. Okay, so water deprivation test generally measures the concentration of the ability of the kidney with the fluid restriction. Okay, there is a differentiation between the central diabetes and the nephrogenic diabetes insipidus. Okay, so water deprivation test will give you the idea about the concentration of the fluid restriction and even will give the idea of the central diabetes and the nephrogenic diabetes insipidus. Okay, so how we go for the water deprivation test? So generally we told patient to restrict the water intake. Okay, so restrict the water intake at around 12 to 24 hours. Okay, so if there is rise in the specific gravity and the urine osmolarity, we said that the urine concentration ability maintain. If there is no rise in the specific gravity and the osmolarity, we administered the desmopressin. Okay, desmopressin is one of the drug we administered. If there is rise, we said the patient having a central diabetic insipidus. If there is no rise, we said the patient having a nephrogenic diabetes insipidus. Okay, so these are the different tests we go for in the kidney function test. Any confusion till now?
No, ma'am.
किसी को भी
No,
कुछ
ma'am.
कुछ भी confusion है तो you can ask or write it down in the chat box. So these are the generally tests we go for the examination of the kidney. Okay, then the treatment part. So generally, when we talked about the treatment and the prevention, obviously appropriate treatment will vary. Okay, so depending on the cause of the kidney disorder or the depending on the whether the patient having a acute renal failure, chronic renal failure, kidney stone or glomerulonephritis disorder or the Tibbles disorder. So every according to disorder, the treatment part has changed. Okay, but if the common treatment part we checked about, so our main goal of the treatment is to treat the underlying condition, to minimize the kidney dysfunction, control the symptoms, and prevent the progression of the kidney disease to the extent possible. Okay, so in cases of the chronic renal failure also, our aim is to कि जो भी अब तक हुआ है, जो भी इंजुरी हुई है किडनी को, दैट कैन प्रिवेंट, एंड उसका जो प्रोग्रेशन है या फिर कॉम्प्लिकेशन है वहां तक ना जा पाए. दीज आर द मेन गोल ऑफ द ट्रीटमेंट. ओके, सो समटाइम ऑल्सो जो भी किडनी का डैमेज हुआ रहता है या किडनी इंजुरी होते हैं, दैट कैन बी रिवर्सिबल, वी कांट चेंज, बट वी कैन प्रिवेंट द कॉम्प्लिकेशन. सो द appropriate treatment also vary depending on the different kidney disorder. So even for the people with the diabetes and the hypertension, monitoring and controlling their condition is very important, okay, which can help to protect the kidney from the damage. So there are certain medications also which can be used to relieve the some of the symptoms of the kidney disease. So for example, if there is patient having the anemia or the edema, or there is low cholesterol, so we go for the different type of the medications according to the symptoms of the patient with a dietary changes. Okay, so some kidney conditions such as the infection and the some acute kidney injury can be resolved within causing a permanent kidney damage. Some kidney disorders may not need any medications. For example, in cases of the kidney stone, if the kidney stone is very small, we only go for the hydrotherapy. So hydrotherapy means, so we ask the patient to drink a lots of water. So in that condition, we don't go for any type of the medication. But some conditions where we have to go for the medications. Okay, so treatment part is also vary. So even in cases of where the kidney is so damaged or the end stages of the renal disease, we have to go for the dialysis and the kidney transplant surgery. If there is fluid and electrolyte abnormality, you have to go for the replacement therapy. So fluid and electrolyte, you have to normalize the electrolyte balance, electrolyte abnormality, and the fluid level. So generally, if patient is at the end stage of the kidney disease, we go for the renal transplant or the biopsy. Okay. So we do one thing, because dialysis and the renal transplant therapy, it's very large topic. We do one thing, we will take it tomorrow. Okay. हेलो. सो कल हम लोग
Yes, ma'am.
रीनल ट्रांसप्लांट एंड द डायलिसिस कैसे करते हैं या फिर क्या क्या इंडिकेशन है वो हम लोग कल देखते हैं. अब तक का कुछ कंफ्यूजन है, सो यू कैन आस्क मी. कुछ कंफ्यूजन है अब तक? कुछ नहीं समझ में आया?
No confusion, ma'am.
Okay. So I am ending session here. Okay. Have a good day and have a good year.
Thank you, ma'am.
Thank you, ma'am.